So, Prime Minister, it's been quite the year, and I know you want to talk about the future, but let's begin with the event that's dominated all of our lives in the last few months, the coronavirus. What have you got wrong so that you get it right next time?
I think, Laura, when you look back at this crisis, everybody can see that this was something that was new, that we didn't understand in the way that we would have liked in the first few weeks and months. And I think probably, the single thing that we didn't see at the beginning was the extent to which it was being transmitted asymptomatically from person to person. That wasn't clear to us or to anybody. But I have to tell you, and there will be plenty of time, by the way, to look back at all the other things that we need to learn, and there will be an occasion to do that. But I am very proud of many of the things that people in our public services did, that members of the public did to deal with coronavirus, whether it's building the Nightingales or making sure that we protected the NHS, finding the first really usable preparations, and so on.
And many things were achieved, but what you're saying today now is that the response was too slow because the disease wasn't understood.
I think it's fair to say that there are things that we need to learn about how we handled it in the early stages, and I've mentioned one thing in particular. But I think what people really want to focus on now is what are we doing to prepare for the next phase.
But Prime Minister, people also want to know what happened, though. But Prime Minister,
you're talking about this as though it's in the past,
but
Laura,
people want to know what happened,
because
hindsight isn't just a wonderful thing, it's also just a useful thing, and people want to know what happened. 45,000 people died who've tested positive. What do you think the mistakes were? Surely it's right to acknowledge them in order that they don't happen again.
Of course, and we mourn every one of those who lost their lives, and our thoughts are very much with their families, and I take full responsibility for everything that government did.
But you say we didn't understand the disease quickly enough at the beginning. Quite understandable. But did you take it seriously enough at the start? So on the 3rd, 5th, 7th, 9th of March, you were shaking hands in public when already the government's advice was advising people not to do that. Did you personally take it seriously enough?
Well, that's not what the government's advice was at the time, but let's be absolutely clear.
Well, it was on the 3rd of March. Sage said the government should advise against greetings such as shaking hands.
Well, that was not the advice that was given to ministers at the time, but it's true that there were differences of opinion, and there were plenty of people who were not aware in the early stages that it was being transmitted asymptomatically, as I said. And there will be plenty of opportunities to learn the lessons of what happened. But the best way to honour those who lost their lives, the victims and their families, is now, because you keep talking about this as though it's in the past, Laura, and as though we must now have a look back. Actually, we need to make sure that we're prepared for the future.
And isn't that precisely why it is right to be honest about what happened?
We're getting on with our work of preparing for what I'm afraid could well be a resurgence in the winter months.
But Prime Minister, isn't that precisely why now is the time to be honest about what went wrong, so that people can be confident that it won't happen the next time? I mean, do you regret now that lockdown happened when it did? Many people believe it might have been too late. You've admitted we didn't know how much the disease had already transmitted.
Again, Laura, you're trying to sort of, if I may say so, you're trying to run a kind of inquiry into what happened in the past. When I think when you listen to the scientists, the questions that you have just asked are actually very open questions as far as they are concerned, and there will be a time, obviously, to consider all those issues. But I think what the public want us to focus on now is what are we doing? The public's done an incredible job. They have helped to get working together, tackling the disease, using the social distancing measures, following advice. Collectively, this country has done an incredible thing to get the disease down to the levels it's at. But we all know that it can come back, and we can see what's happening in other countries. I won't name them, but you can see the resurgence that's happening. We know that we're vulnerable to that. So that's why we're getting on now with our preparations for the winter. A massive, very important, Laura, a massive flu vaccination programme,
But Prime Minister,
stockpiling PPE,
but Prime Minister,
making sure that we ramp
exactly
up
as you
test and
say,
trace, and making sure that people get tested if they have symptoms.
and it is, of course, very important to be prepared for the next wave, but surely the best way to be prepared is for people to be confident that the government will act quickly enough the next time. I mean, wasn't there a pattern that developed over time? You said you didn't need to ban public gatherings, and then you did.
No.
The government said we didn't need to wear face masks, and now we do. You didn't pursue community testing, and now you say that's vital. Isn't this a story of delay
No.
that
On the
sadly
contrary,
cost
actually,
lives?
No. If you look at the timing of every single piece of advice that we got from our advisors, from SAGE, you will find that whenever they said that we needed to take a particular step, actually we stuck
Well, maybe
to that
your scientists
advice
were wrong.
like glue. And well, Laura, you know, maybe there were things we could have done differently, as I've said. But I think what people, and of course there will be time to understand what exactly we could have done, but or done differently. But what I think the public want us to do now is to focus on getting the preparations ready for what, as I say, could be a resurgence of the virus this winter. And I've talked about the flu vaccination programme, the PP stockpiling,
and in that preparation,
the drugs that we're stockpiling, and of course making sure that test and trace is ready. But we're also getting on with our work of preparing for the economic
and we'll come to that in a second, but in that preparation, if there is a second surge of this ghastly disease, this time, will the government actually protect care homes? Your Health Secretary claimed that a protective ring had been thrown around care homes. You know that's not the case.
Well, we've done a huge amount, and I've mentioned
but it was too late, wasn't it?
I've mentioned the difficulty of asymptomatic testing, but actually, thanks to the fantastic work of our care home sector, if you look at what's happening now, the number of new outbreaks in care homes is massively down, and you saw the care home action programme that we brought in a few months ago. It has worked, and we're testing every care home worker weekly, every care home testing every care home worker weekly, every care home resident every 28 days. We will increase testing both for NHS
care homes
and care home workers, both symptomatically and asymptomatically. And so we're learning the whole time. And what I would say to you is that, yes, of course, it's been an incredibly difficult time for the country. And yes, there are lessons to be learned. But I think what people want to see is a focus now on the next few months, how we're going to deal with the two things coming together, the medical crisis and the economic crisis.
And I'll ask you about that in just one second, but also this disease also affected you personally. Did you think you were going to die at that moment when you were so seriously ill?
I was very lucky, and I was treated. I had fantastic doctors and nurses in the NHS. One thing, by the way, that I think did make a difference is, and for me and for quite a few others, is, and this is an issue that we're raising today, is the issue, frankly, of being overweight. And that's why we need to tackle our national struggle with obesity. Typically, our great country tends to be a little bit fatter than many other countries in Europe. And so you ask about my own personal circumstances, or one of the lessons I drew from that is the need for us all to be fitter and healthier. And if we're fitter and healthier, by the way, we will also be happier. And here's the key thing, if we're fitter and healthier, and if we lose weight, we'll be better able not just to individually to withstand coronavirus, but we'll do a great deal to protect the NHS.
So what are your priorities now?
And that's why we'll be bringing forward an obesity strategy.
Next week?
Very soon.
What is your priority now? I mean, you've had this roller coaster year. What are your priorities now?
Thank you. I mean, the priorities exactly. The priorities are exactly what they always have been, except more so. Except we're doubling down. Look at what happened. I got elected on a programme to deliver Brexit, unite our country and our party, and the Conservative Party, and defeat the then leader of the opposition and win. That's what we did, and to energise the country. Now, actually, what we need to do as a country is double down on that agenda. So I'm very proud of the things that we are doing. We are delivering the 40 new hospitals, and there will be spades in the ground by 2024. We are recruiting 20,000 more police officers, and we've already got I think between 3,000 and 4,000 more. We're recruiting the 50,000 more nurses. There are already 12,000 more nurses in our NHS than there were a year ago. 6,000 more GPs. We've done things like stopping the early release of terrorists. We've got a new immigration system coming in. We are delivering on the priorities of the British people. We will build hundreds of thousands more homes, help people to have the joy and the opportunity of home ownership, which has been denied to younger people for such a long time now. We're getting on with our agenda, but what COVID has taught us, and gets back to your earlier questions about delay and all, COVID has taught me that for too long this country has moved too slowly sometimes, and so we need to go faster. And when we look at some of the obstacles and problems that we have as a government and as a society, we need sometimes government, that's me, to be willing really to push and to move things along fast. If we're going to have any hope of delivering the infrastructure that we need, delivering gigabit broadband to every home in the country in the way that we need, then we're going to need to move fast. So that's why we've set up Project Speed. That's why I want to see us doubling down now on that agenda of uniting and levelling up. Now, that's the right thing to do anyway, but it's especially the right thing to do now that we face the economic turbulence caused by the COVID crisis. And so that's what we want to do. And so you say, well, what's the agenda now? The agenda is what it was when I stood on the steps of Downing Street a year ago. But we want to go further and we want to go faster. And the test for me of success, of whether I've delivered on what I said to the British people, will not be just whether we've managed to get the hospitals going and whether we've got the police out on the streets and all the things that we want to do. It will be whether life is really starting to feel different, to be different, whether we're offering more hope and more opportunity for people who entrusted us with their vote in 2019 from parts of the country that perhaps had never voted Tory for a very long time, if at all. That's going to be my test. That's my personal test. And yes, the country has been going through a very, very tough time. And psychologically, it's been an extraordinary time for the country. But I also know that this is a nation of incredible natural resilience and fortitude and imagination. And I think we will bounce back really much stronger than ever before. And so there's one thing that we're going to be focusing on, particularly in the bounce back agenda, and that is the green industrial revolution, green technology, green jobs, and delivering on the low carbon agenda. And there, I think you have the chance to tackle all sorts of problems at once, not the environmental problems, CO2 and all the rest of it, but also the economic difficulties, the need to create hundreds of thousands of jobs. We can do it.
Prime Minister, thank you very much indeed.
Thank you.